My name is Christine Stenquist, and I'm a medical cannabis patient. In 1996, I was diagnosed with a brain tumor, an acoustic neuroma. It's a benign, slow-growing tumor. I was having symptoms when I was working at a hospital. As I was walking specimens back from the lab, I had a shot of pain across my face. I had passed out. When I awoke, I was a patient in the emergency room with my colleagues standing around me. Went through some testing, and that's when they discovered the tumor. Because of the location of the tumor and the size, they were concerned about it pressing on my brainstem, and they wanted to have surgery quickly. I was given a month to get my affairs in order. At the time, I had a 5-year-old and a 3-year-old child, and so I needed to figure out who was going to raise my children if something should happen to me. I was giving a 50% chance of survival. I think they just tell you those odds so that you can be prepared for what may happen. During surgery, after 40% removal of the tumor, they hit a blood vessel, and I started to hemorrhage. The bleeding led to stroking, and I slipped into a coma. So I experienced some left-sided weakness from the stroking. I had to learn how to talk again and walk, and went through a long time of recovery trying to gain my balance again. Unfortunately, I was never able to regain my strength to head back to work again, and I had spent the next 16 years in a housebound and bedridden life due to the pain and the circumstances surrounding my recovery. About 6 or 7 years ago, I had hit another pain wall. And oftentimes, because I was on such heavy opioids, I would have to go into the hospital and go through sort of a detox. I would hit the ceiling on how much my doctor and myself were comfortable with, and I'd try to work myself down a little bit off of it. Well, this particular pain cycle, I was unable to keep the medications down. At this point in time, I was on a fentanyl patch. I was getting Dilaudid for breakthrough pain. Percocets were my other breakthrough pain. It was going nowhere fast. I wasn't getting the pain relief I was hoping to. I'm diagnosed with trigeminal neuralgia, which is a severe facial pain condition. I have a burning, fiery feeling on the face. It's like an ice cream headache that never goes away. And the pain had gotten to a point where I was unable to eat, and I was not able to keep food down. It was getting pretty intense. So asked my husband to take me to see a physician again. I wanted to try medical cannabis and see if it would be something that I could at least get my nausea under control so that I could keep food down and medication down so I can sleep again and eat. And I went to my physician and I told him I wanted to try medical cannabis. He told me not to do anything illegal and sent me to another pain clinic that put me on Marinol, which is synthetic THC. It's an FDA-approved drug. I started that therapy and I got moderate relief at first, but what I couldn't get used to with side effects from it. So I went online, started to do some research about Marinol, and that led me to finding blogs by other patients, information about cannabis whole plant versus Marinol and which one was better. And this led me to contemplate actually using whole plant, and I wanted to see what that was like. But before I did, it was important that I made a phone call to my father. My dad is not only my hero in a lot of ways, but he's also a narcotics officer. And so it was really important to me to just sort of get his insight. He did undercover narcotics during my youth, and I wanted to know what his experience was like, or at least get an idea of what to anticipate. I was really apprehensive about asking though. And I did ask him about his thoughts on medical cannabis, and he was really encouraging of me to try and see if it helped. He lives in Florida and I live in Utah, and he said that he was seeing on the news patients talking about their experience, and he felt like after 16 years of hell that this might be an option and we should at least try. My biggest concern was that I told him I'm in a state that's not legal, Daddy, and I don't know how to find cannabis. And he made a joke. He says, I'm sure you can find a bag of cannabis somewhere in the state. And sure enough, he was right. I did find medication, started using it. Within a couple of weeks, I had gained enough strength back where I was sleeping and starting to eat. I was able to start getting out of bed. I was using my cane around the house and walking. And within 6 months, I was driving again. And 8 months after that, I decided I had to do something to change the laws in my state. I had to do something legislatively to help other patients like me. I was going through miraculous recovery. And so I made my way to Capitol Hill. And during that process, I met a legislator who was going to be running a whole plant bill. I watched the CBD movement come online. I was there in my own state trying to advocate for whole plant and educate on whole plant. And that spiraled into starting a nonprofit and continuing our efforts not only in our state but also on the federal level. And I hope and I pray that one day that patients in our country will have safe, reliable, affordable, clean medicine that we all deserve access to. And I don't think I'll stop this fight until I see every patient in our country able to do that.